Omicron, currently in 36 states. It's in North Carolina. That was reported last week in Mecklenburg. What we're seeing early on is more contagious, more likely to lead to breakthrough cases, but mild if it's a breakthrough, if you've been vaccinated. Small risk of serious illness to most vaccinated individuals is what we're seeing. And the boosters appear to make a major difference with Omicron. So really, even if your health is not vulnerable, a booster can reduce the chances you contract COVID and pass it on to someone else who's vulnerable. So that's what we've been really saying all along with our vaccines is, especially even with children, it may be mild case, most likely for a child or for a young adult, but you could pass it on to someone with a weakened immune system who is more vulnerable, and it could be very severe. And my last slide, just, with winter coming, concerns, obviously, that I have. Delta cases are continuing to go up. What we're seeing now is Delta, but Omicron, what the CDC is saying is it looks like mid-January is when we're going to see the brunt of Omicron in the United States. And then we have flu activity that's starting in the area. So all of those areas, could create a lot of illness in our community. And really the actions that we need people to take are to get the vaccine, whether it's your first or second dose, it's not too late. Get your booster, wear a mask indoors in public, and really it suggested you could get a test before family gatherings as we enter the holidays to make sure you're not asymptomatic. March 12th, when we had our first 2 cases, if you just said, Joshua, 21 months from now, you're gonna, it's really you're gonna be averaging over 120 cases per day, and you'll have had months in last January and this past August where you're over 200, 250. No, I think obviously we didn't realize it. I think we've become in some ways, I think we've become numb to the numbers because, 135 cases today. Well, out of 135 cases, right now at the death rate we have, that means 1 or 2 people are going to die. They got COVID. If you look at the death rate among our older population, it's much higher. It's more like 9 or 10%. So it's obviously, and people will say, well, they had health conditions. Well, over half of the American population, adults, have some health condition. High blood pressure, diabetes, overweight, obese, former smoker, current smoker, so there's lots of health conditions that we all have. So I think we just have to, but yeah, put it into perspective, Richard, I guess in the last 21 months looking back, no, didn't expect this. We were on track to literally have 80% of our population vaccinated by Memorial Day, maybe July 4th at the latest. But if you remember early April of 2021, it just stopped. People just we were at the fairgrounds, we were doing 1,500 people a day, and it just hit a wall. So concerning that we're going into a second winter.